He set up an experiment where you put a microscope and you look at the whites of the eye. You know, the whites of the eye, you can see the little red blood vessels. And he took pictures of the whites of the eye, and you'll see here a section of the eye, the conjunctiva. You see very nice blood flow there. And then what he did is he fed this person one meal high in saturated fat. It was 67% fat. It was 2 eggs, 4 strips of bacon, milk, cream, bread, 2 pats of butter. Mary and I were just in the restaurant here at the Marriott having a bowl of oatmeal. I probably saw 8 out of 10 people eating a meal just like that. One meal. And here you take a picture of the same area of the eye 4 hours later. Yeah. And by the way, I want you to know that when they repeated this experiment using safflower oil, vegetable oil, you know, health food vegetable oil, the sludging was more severe and lasted longer. Yeah, so keep that in mind. So this kind of effect on circulation, you can broaden this to lots of problems that you see. Fatigue, chest pain, angina. People who have narrowed heart arteries, it's been known for 100 years, probably 1,000 years, but it's reported in the medical literature for at least 100 years, is they get chest pain after they eat. And what medical students were taught back when I was a medical student, what they're taught today, is the reason they get chest pain is because the blood goes to the gut to digest the food and is taken away from the heart. That's not what happens. What happens is you get profound changes in the circulation. You get this sludging, this rouleau formation. If you measure the oxygen tension in the blood of people, and you just take a needle and you stick it in their artery, and you measure the amount of oxygen in the blood, and you compare it pre and post meal, there's a 20% drop in oxygen content in the blood after one single meal. So you can imagine somebody who has narrowed heart arteries, when they eat and they cause a 20% drop in oxygen in the blood, and they cause all this sludging, they get chest pain. And of course, this has led to a very effective treatment for people who have coronary artery disease. When they change from the typical American diet to a low-fat diet, the chest pain goes away. This was published in the 50s and the 60s. Dean Ornish published it most recently in the 80s. This is time-honored, simple, fundamental, safe, cost-free treatment. You sludge the circulation of your brain and you get problems with thinking, TIAs, and it contributes to strokes. So this, what you're seeing here with Dr. Swank's work on multiple sclerosis, carries over to the rest of the body.